Welcome back to another episode of Lifetime Talks. I'm David Freeman.
And I'm Jamie Martin.
And today's topic, we're going to be talking about low back pain. Low back pain is one of the most common issues many people deal with today, and it's estimated that 80% of adults will experience back pain at some point in their lives. For some, it's a temporary concern, and for others, it's a chronic issue. For both, it can affect their day-to-day lives. And we got a special guest with us today. Who we got, Jamie?
Yeah, we have Dr. Reza Alizadeh with us today. He is a doctor of chiropractic and the founder and CEO of Life Clinic Chiropractic and Rehabilitation at Lifetime. It's a nationwide network of clinics dedicated to restoring, maintaining, and optimizing human function. With over 30 years of clinical experience, Dr. Reza has helped thousands of patients overcome pain, move better, and live healthier lives. He is known for developing the integrated muscle and joint therapy, also known as IMJT for short, technique. It's a patented technique used exclusively at the Life Clinic that integrates chiropractic care, functional rehabilitation, and lifestyle medicine into one seamless system that empowers patients to take control of their health. And we like that when people feel empowered. Dr. Reza, thanks for being with us.
Thank you for having me.
Yes, welcome. So I kind of mentioned it in the intro, how prevalent low back pain is and how many people are probably being affected by it. How common within the practice of what you've seen over the years is lower back pain?
One of the most common reason behind it is it's a complicated joint, and it sits at the base of your pelvis, where all movement leveraged in that area. So any dysfunction, any stress, any malposition of those vertebrae, or the musculature around it, or the nervous system around it, will trigger a pain response.
Yeah. Well, why is this happening to so many people? What are some of the most common causes for this low back pain? I mean, to say that almost 80% of people will experience it in their lives, that's huge, right?
Well, the culprit is what we're doing right now. It's a chair.
Too much sitting.
The invention of the chair literally put us in a disadvantage of the low back.
Yeah.
Because when we squat, we have full flexion in our hips, knees, low back is supple. When we move around the floor, getting up from floor to stand, these are all motion that we don't have anymore. We sit in our chair, we go home, we sit at our table, we go sit in the car, and then we get excited to put an hour of working out, and we think we're heroes. But really, it's a lack of multiple position movement during every living life day that would put us in disadvantage.
Yeah.
Just think about it. If you sit in a couch for 2 hours and you want to get up, what happens?
Back
Pain.
You feel the stiffness. Yep.
Yeah.
So there is a very beautiful harmony in human spine that you can only have either pain fibers or you can have motion fibers.
Yeah.
You can't have both of them. When you smack your thumb with a hammer, you feel pain.
Yeah.
Immediately, what do? You grab
Yep.
and you move. The minute you move, it's such a beautiful cascade of neurology.
Yeah.
There is a nerve right around the area that you move, and it's called recurrent meningeal nerve. It comes and suffocates any of the pain fibers to reaching this brain. So that's why movement is actually the medicine for majority of the musculoskeletal pain, particularly low back.
Yep.
This lack of movement causes pain. Movement is the remedy.
So what about, I'm thinking about people holding their devices and posture problems, like how we're sitting. What impact is that having? I mean, so often we hear about the impact of where a lot of people are looking at their phones, their heads are tilted down. What is that doing to our low back?
Well, it's everything in the body is related. We call it compensation. If you, let's say, smack your big toe with a hammer or drop a brick on it, you automatically shift your weight away from that big to make sure that you can not irritate that. And then you have to move to the left, and then upper back going to come to the right. Ultimately, as a human being, the most important thing is keep your eyes level to the ground. Even the most crippled person in the world sits down like that. You don't going to walk him like this.
Yeah.
So that balancing movement with the eye would determines where is the compensation is coming. So anytime we are hunched over, we are exacerbating this back curve. Something else got exacerbated and compensate for that excessive motion. If you hunched over on the device, that means your pectoralis, your chest muscle is going to tighten up. Because muscles are expensive. They're not. If they're not using, it just body says doesn't need to have a lot of motion. So just keep them like that. And when the shoulder is rolled, the head drops to forward, and then these little muscles are trying to pull the head back. Well, guess what happens when those muscles gets to be so tight? The blood flow to the brain slows down.
Oh, interesting.
There is a case called hypoxia, because brain loves the oxygen.
Right.
And when there's no oxygen, there is a nervous system that goes and says, hey, dilate those veins and vessels and send me more blood.
Yeah.
That's why you get that pounding headache. So it comes in from here, this kind of scooching motion like that. And it has a ripple effect to the rest of the body.
Oh, that makes sense. Okay.
Yeah, and then prior to jumping into the podcast, you said something super interesting that I want to make sure our listeners get. I was talking about acute pain in the lower back, and then you said once it goes beyond 3 months, it becomes chronic, and you said something about the mental piece of that. Can you elaborate?
Yes. So we used to think pain was just biological, like I squeeze you and you say, ow. So, but then we learned that it's biopsychosocial. So there's an element of, huge element of mental need when you treat low back or any pain that is over 6 months. You have a pain centers resides in bunch of places in your brain, but posterior insula is like a seeds of pain. Like when you have pain, you took a functional MRI, you see this lights up like a grand opening in 4th of July. So, but when after 6 months, that area kind of shuts down. And then amygdala, wakes up, which amygdala, we all know it's a seat of anxiety, overprotective mama bear that makes you get jittery, makes you be worry about anything that happens around you. So that's why chronic people who have pain for so long, not only you have to treat them biologically, with their spine and with their nervous system and with their skeletal system, but also you got to go and work with them on how they perceiving this pain. Because pain is completely subjective. You could have all the evidence that you should have pain based on your MRI and you absolutely have no pain, or you have all the pain but no pain fibers are actually firing at all. So pain is a very complicated matter. So pain is not really the most important thing. The root cause of why that pain is there to begin with, that's the most important thing.
If you can walk us through an example of how to treat the mental piece. Like how would you, if I'm going through it now, more than 6 months, what's an example of if I'm across from you and you're treating me, how would you address me mentally?
Perfect. Every time we get conditioned how we perceive pain.
Right.
You say, oh, I can't do this because it's going to cause me pain. I can't do this, it's going to access it. I can't do this. Rather than worrying and being afraid of pain, you have to accept that for every thought of pain, I'm going to have a thought of healing. See, for me to when I work with patient at the Life Clinic, we ask the patient to close their eyes. Because there is a system called sympathetic and parasympathetic. I explain. Sympathetic is fight or flight or run. Parasympathetic is wine and dine and healing. So if my eyes are open, I'm automatically watching for predators to attack, or do I attack them? That's just primordial response when the eyes are open. And so I want to make sure our patient is going to parasympathetic state of mind during the care. They're with us for half an hour. We work on them and we ask them to close their eyes. One, have them take a deep breath through the nose. Every time you inhale, your blood pressure and heart rate goes up. You can do this with this, and it's pretty cool. And when you exhale, it comes down. So low blood pressure and low heart rate. So if you elongate the exhale, you create a parasympathetic state of mind. And then we ask our patient to breathe with the sound of a shush.
Okay.
because it's the first sound that primordially we're geared toward and we respond to. That's the uterus that we reside in, that the embryonic fluid was there. And
Yeah, you hear it like on an ultrasound.
Absolutely.
You hear it, yeah.
And that's why moms that they have received those white noise.
Yes, yep.
So we drive patient to parasympathetic, and at parasympathetic, the sympathetic fibers are slowing down.
Okay.
So the mental aspect of it is not affiliating the treatment to pain, rather treatment to a state of relaxation, state of rejuvenation. And when we get our elbows and knees on patient and restoring their motion, they have a much different encounter with treatment rather than pain focus.
Yep.
Good.
Does
Yeah.
that make sense? Did I
Yeah,
explain
I
that?
mean, the nostalgic piece of what you just did, taking us back into the womb, like 100% from the mental side of it, the closing the eyes, usually what you said, if you see something, you believe it, right? The fear factor there. Then you went into the breathing, bringing them into a calm state, and then that sound effect of what takes us back to
That
the womb.
that
Yeah, so
sound.
all of that makes sense.
And ultimately, David, if I tell you, you have your structure, just your shoulders are sitting, I want to ask you a question. Take a deep breath in. On top of the exhale, drop that shoulder for me. There we go.
You can see it happen.
You saw that.
Yeah, I saw it happen.
Yeah, so I'm training you that on the exhale, this can be relaxed. And automatically you respond to it. Just like Pavlov and the dog. If I have you to 6-10 visits with me, and I direct you to say, when you're exhaling, feel this low back is loosening up.
Yep.
And then you kind of let it go. And then I will actually, not hallucinatingly, actually physically, I'm going to induce that motion.
Right.
And then you can couple those things together in subconscious mind.
Yeah.
And it will open a door to have a mental breakthrough from this pain.
I wanted to,
Yeah, keep going.
From that though, like how many sessions usually does it take? I know everybody could be different and it can vary, but like what would you say is usually where you start to see that light bulb?
I'm gonna give you the best case scenario.
Okay.
I just got a testimonial from one of our doctors.
Okay.
And I would love to share it with you guys. This patient comes in for months and years of shoulder issue.
Okay.
The orthopedic has suggested shoulder replacement,
Okay.
not replacement.
Yeah, that's a big
Replacement.
deal in this. Like, does that happen very often? I don't think.
Very, very seldom.
Yeah.
And she is a swimmer.
Okay.
One visit was able to say, I can swim right now, and I don't have to go through shoulder replacement. So, however, the fastest way we can restore the motion, the fastest recovery there is. Right now, on an average, what we like to do, not only bring people out of pain, but also maintain and optimize them.
Right.
So to get them off the pain, 6 to 12 visits, I would say, on an average.
Okay.
We do a 18 visits program because after the acute stage, we want to drive patient toward a bit of an independent. And I tell you why is it complicated. I can't say an exact number.
Right.
If you look at this microphone, what does it weigh? Like 10 pounds, 15 pounds?
Okay, yeah.
So this is going to be constant. Weight is the constant. I can come back in 10 years, it's still going to be the same.
Right.
But today I'm in a good mood. I'm next to you guys. I feel good. I slept great. I'm having a good time. So I can maybe put this and push it over my head 20 times
Yeah.
Yep.
without exhausting.
Yep.
But tomorrow, if I have a bad day, if I didn't sleep, if I'm not hydrated, I'm pissed off as a word. If I do the same exact thing, I became a variable.
Yeah, the variable. Yeah.
This is the constant.
Yep. You're the thing that's changing.
Exactly.
Yeah.
So we try to teach that to our patient.
Yeah.
So they are mindful of their movement on the floor. In lifetime, we're blessed to have millions of dollars worth of equipment.
Yeah.
So we want to make sure our patient are completely comfortable and confident that when they go on their own, doing alpha, doing Pilates, doing yoga, that they can understand where the movement needs to be safely induced.
Right.
Right.
So weight is constant. We are the variable. How variable? Well, you're in a great shape, no? So you can get there much quicker. So if somebody is like really out of shape, they're not moving, they've been hurt by injury for a long time, obviously it takes a little bit longer. But we're extremely blessed. The technique has been working. We've been healing and treating thousands of people.
That's awesome.
That's awesome.
Yeah.
I want to bring it back to the low back because that's the one you hear about all the time. Why is it so much more common than like mid or upper back issues? Like why, I mean, obviously you talked about why this happens, like how we're sitting, but it's just, we don't hear about mid back pain or upper back pain very often or nearly as often.
There is, so mechanically, there is lot less stuff going on in our neck than in our hips and the low back.
Okay.
So if you're a pregnant woman, what's their first thing? They have to shift. They have to, everything we lift requires destabilization of the low back.
Yep.
We have, you know, the older weightlifters, they make a belt.
Yeah.
Why do they make a belt in here? Why don't they make a belt on their neck?
Yeah.
Why don't they make a belt on their T-spine?
Right.
Because that's where the load resides.
Yep.
Yeah.
Okay, and then maybe knee, but knee is kind of a simple joint; it just flex and extend. There is so much neurology also going there, where all the nerves distributes to the lower extremity.
Yep.
So that's one of the reasons is biomechanically we're at disadvantage. Now, if we didn't have this, we probably wouldn't be able to. We probably wouldn't have to treat low back pain as much because by nature, this is our corset. The core is not just front; the entire segment
Wraps all the way.
All.
Yep.
And also the fascia model. There is a model that it's kind of that when you cut meat,
Yep.
when you get to that white area that's very hard, it's not cutting. That fascia model also crosses at this area.
Yep.
So it's physiologically is a challenging zoned area.
Yeah, there's a lot happening in
Yes.
that region of the body.
Yes.
Yeah.
Yes.
That makes sense.
Yes.
Yeah, I like how you alluded to like the strength training, the references that you were giving. So when it comes to strength training, individuals who are looking to strengthen that midline and that overall core, what are certain exercises that you would say that they should be doing?
Starts with breathing.
Okay.
It's amazing that how we don't know how to breathe with our diaphragm. So it's just crazy that you ask people to breathe, they can't. You'll be able to induce a lot of mobilization just by breathing alone. When you're diaphragmatically breathing. And holding our plank would be another great thing.
Yep.
You know, bird dog is another great thing. Again, depends on where the sources of pains are, then the exercises will be delivered for that condition.
Right.
Like, you know, people who's got they call it stenosis, like those narrowing of those holes that the nerve root exits, they actually have a much better time when they're flexed forward. But if I have a disc patient, I ask them to flex forward, that's going to flare them up.
Right.
So it definitely, I would say, if you have pain, don't try to figure it on your own. Just go see your practitioner. And obviously at clinic, we're there to help every one of our members too, that they might need. But it's complicated, so you can't say. But what I would say, mobility would be the best thing for everybody.
Yep.
Yeah.
Low force mobility.
Yep. Talk us through that, like because you're talking about the bird dog, you mentioned the plank, but let's talk. You said low force mobility. Is that
Low force?
Okay. What do you mean by that?
Means not swinging, not twisting, not like, you know.
Okay.
We want something like gentle and mindful.
Okay.
Flexion, extension, rotation, lateral flexion. Those are the mobilities that we just want to have. And you'll be surprised how many of us don't have.
Well, it's so interesting. I mean, we have, obviously at Lifetime, we have, you know, more than 1 million members, and they're there because they want to move their bodies in many ways, right? So making sure that we encourage and are always letting people, like, mobility is part of your routine. Like, how do we make sure? Because that's going to help hopefully prevent injuries or problems down the road. So how do we encourage that everyone, and like, take 5 to 10 minutes before you start a workout? You're not just jumping in cold, right? Get in there and move your body a little bit.
Absolutely. If again, swimming swimming would be one of the best thing because it's not weight bearing.
Right.
So that's one great things. Our stretch labs are great. The dynamic stretch, the clinics we have a great respond with people on mobility. I would say any kind of movement is great. But let me alarm you that 40% of people within 6 months of beginning an exercise routine and including walking, they will have a injury.
Oh, that's a lot of people.
That's a lot
yeah.
and I'm talking about simple walking.
Right.
Because if I'm compensated under normal circumstances, that I'm not putting my body at the pressure on force.
Yeah.
And now I begin a routine of I keep walking and I'm like shifted.
Yeah.
It's just like a tires in the car.
Oh, yeah, that makes
It just gets worn out.
Yep.
Even in a simple walking or a step master in a level 2 or 3.
Yeah.
So it's always nice if you're already investing to come to Lifetime, if you're already investing, putting the time, take another step. Look at yourself and talk to a trainer, talk to a clinician, and get a consultation at least. That's the least you can do.
Yeah,
And
see
our
where your
consultations
ROI
are free for all of our members.
Yeah.
They can come and get a consultation at any time, and there's no charge for it. And that's why we're there, because
Yeah.
we want to make sure our members never quit.
Yeah, we want to keep them moving
That's
for as
right.
long as possible.
That's right.
right.
Because if
Okay.
you go to your primary care, we say, I have a shoulder pain, the first thing they're going to say, well, stop doing what you're doing.
Yeah, yeah.
Well,
Yep, don't do that. Well, I think that gets right to what the next question was. It's like we talk about how like many cases of low back pain are preventable and fixable. So can you speak to that for a little bit? We're kind of getting to that here.
You know, most people, particularly in the older population, when they get back pain, they think it's a death sentence. It's absolutely not. First of all, let me bring some awareness on low back.
Yeah.
We're talking about mobility.
Yep.
In that last vertebra of the lower back area, you're contributing maybe 2% of your flexion to it, 2 to 3%. Now, I don't want to stand up and demonstrate, but I have a lot more motion when I'm flexing in my hip. So even though people with a highly arthritic low back, they don't have to suffer for inability to move. Because they get worried that if I move, my arthritis is unstable and it causes me more. It's completely the opposite. When you have arthritic issue, you need to move more.
Yeah.
And most people get afraid. So that's why us as a professional should be able to hold their hand, walk them through, get them over this fear factor. Because what fear does inhibits you from getting engaged into the activity.
Yep.
Rather than take the obstacles and let them run.
Yep.
Yeah, and I think also we always are reactive in this space. So how would you explain to the listener right now, one, when can someone start this proactive care, if you will, instead of waiting till something actually happens? And then also, is it certain ages that can come into and do this, or is it no limit on
Anybody
that?
with the spine.
Anybody with the spine, I love it.
All of
Anybody
us.
Yeah.
And again, let me assure you, there is nothing different from low back remedy than a shoulder remedy, than an elbow remedy. It all follows the same principle.
Yeah.
Yeah.
It's a little bit more complicated, but still the treatment protocol is very similar from low back to the shoulder to the elbow to the knee.
And I remember it was somebody, it was youth. I think it was an infant. And literally we're getting like little adjustments
Yes.
and it helped with their digestion.
Absolutely.
So it's like all these different benefits behind this.
They're mushed up.
Yeah.
You know, they're just
They've
mushed
been
up.
squashed.
Yeah.
They're mushed up, and you know, by the time they come out, they might carry some remnant of that mushing, those area that is kind of stuck. They're not kind of moving, and the simplest thing is hold them from hip upside down. That's all. You don't need to go hammer on them. It doesn't need to be done. All you gotta do is practice that with your just hold them from the hip, flex their hip, lift them up so their head's dangling down, because head's pretty heavy.
Yeah.
That's enough to pull the rest of that spine, so create that unanimous disassociation with the compaction. So it kind of unwinds the tissue.
Man. There's a lot here.
I wish I could do it with the older adult and grab them from
Yeah.
them up.
If only we just lift you up, David. Lift you up.
Good visual.
But that's the decompression table, what it does.
Oh, yeah,
very
absolutely.
much.
Absolutely. Well, let's talk a little bit. You mentioned like getting to the root cause of things. Like, why is that so important? Because we really want to get to the root cause and restore the function with that.
Yeah. So I'm going to give you an example.
Yeah.
If I'm having a left arm pain and you're going to rub my left arm and I'm dying of the heart attack, was that going to do anything for me?
Yeah, right. Nothing.
So the pain doesn't necessarily associate to the dysfunction.
Yeah.
Right.
So if you're chasing pain, you're missing the diagnosis by 50%.
Yeah.
What we do, we put people on their actual functionality to see how they are moving when the body is loaded.
Yep.
Again, if I'm a mattress tester, I'm not going to get hurt.
Yeah.
I'm just testing mattresses.
Yep.
But if I'm in the gym and I'm in the alpha classes and I'm on the weightlifting and I'm just hustling, I got to know what's going on.
Yeah.
So I would say anybody with the spine
Yeah.
and definitely get on movement as quick as possible.
Yep.
From a technology standpoint, we continue to advance in this space. We know that AI has emerged. How has AI helped support what it is that you do in your practice?
There's many apps that are out there that can look at you and with certain degree of accuracy to tell you where your restrictions are. I'd rather have a professional look at me because there's still so many restrictions with those apps.
Okay.
Where you stand, how you stand, and the degree of accuracy and the interpretation of it.
Right.
You can get a shotgun approach and say, yes, I have limited motion on my left shoulder, but it doesn't necessarily would connect it to the root cause.
Right.
And I'll tell you what the billion-dollar question that we can resolve. If I come in with neck pain,
Okay.
hip pain, and ankle pain, and I don't know how it all happens because body compensates.
Right.
Yep.
The only way I can find out what was the primarily diagnosis, what was the cause of the pain, is if I put you on a treatment plan of 12 to 18 visits, and I would say which one of them falling down quickly, because compensation stuff comes down very quickly.
Right.
The one that's stickler is the one that was primarily issue.
Okay.
Yeah.
Apps don't do that.
Yeah.
That's what I'm talking about. It can rudimentally say, well, this is not, your hip is not moving, your back is not moving, and your knee is excessively moving. So therefore, strengthen this, soften that.
Okay.
But you don't understand, you can't differentiate where is the primarily diagnosis, where is the cause of the issue, where is the root cause. Root cause only will reveals when you actually put the patient in program and see how they respond
Yeah.
to your care plan.
And the practical application.
Yes.
Okay.
Yeah, that absolutely makes sense. Okay, we've already talked about why movement is so important for like not moving is actually more detrimental when you have low back pain. Let's talk about the role of strength because that's really important. What areas of the body need to be strong to support the low back?
The entire core structure.
Yep.
The entire core structure,
Yep.
including the glutes, including the hip flexors, including the most missed area, adductors.
Yeah.
Well, because adductors resides in a close to genitalia area. And again, as a chiropractor, we don't discriminate biceps from hip flexors or adductor. So most practitioners elsewhere, they shy away to get to adductors because they say, well, it might be not comfortable for the patient. But we know if you really are genuinely coming to see us and your glutes is the issue, we will explain to you how we are arrived to treat that glutes. And then once the patient consent, we definitely can go and do our work around glute area, around adductors, around hip flexors, around your obliques, around your transverse abdominalis. So it's not just one. It's a cascade of entire thing. And it has to be treated with wisdom because you don't want to overload a area of like a hip flexor, so you're going to have that flexion motion, like,
Yeah.
hockey players.
Yeah.
And forget about the glutes or hamstring or your low back. So it's intricate and complicated. I can't give you a one size fits all.
Right.
But definitely it's a complication of all this neurology that goes there, all the musculature that goes there, and all the structure of skeletal system that is also there.
Yeah.
Because the skeletal system tends to kind of get stuck to each other when they're not moving. And I want to make sure we address this. If I want to move my back to the extension, I can willingly do that. You all can do that.
Right.
But if I have a L5, the last vertebra, and L4 that they are not working properly, I can't just meditate and say, oh, I'm going to move the L4 over L5.
Yeah.
Right.
You need to have a wise hand to diagnose the issue and induce a proper force to that particular segment. Otherwise, that segment is never going to move. That's the magic of adjustment.
Yeah. Right.
Because things get stuck. When we go on the couch, we get formed into that mechanics.
Yeah.
Yeah.
When we sit too long in the chair, we're forming into that mechanic. And body has a system. Use it or
Lose it.
Or lose it.
There it is.
Yep.
Yeah. To complement a lot of what's going on within the chiropractic practice, beyond that, we've seen certain things out here to help support with recovery, whether it's going to the sauna, cold plunge, Normatec compression sleeves, the percussion guns. Like, where does that sit within your thoughts in that space?
I love the recovery modalities. It's any time it's called the term called hormesis. You guys hear that?
Yep.
Hormesis means, can I expose my life to a danger, but without getting destroyed, come back? Then I get stronger. Heat, cold, Normatec.
Yep.
Normatec doesn't go hormesis, but intermittent fasting, things that, sauna, where when you go there, if I stay longer, I'm going to get damaged, but I'm going to go right to push the envelope and then come back.
Yep.
That's definitely, for the standpoint of hormesis, I support. The other ones, the red light therapy is great. I don't know about the hydrogenated water. Those are new stuff that's coming in this town, but I bought one, but I'm not going to use it. Well, but the red light therapy, heat, cold, submerged ice, I love those.
Okay.
Those are mitochondria respond. That's a powerhouse of the cell.
Yep.
It rejuvenates you, makes you feel better. One quick note. How you know you've gone too much?
Yeah.
Yeah.
When you leave that therapy, if you're excited that you want to pick up a phone and call your friend and meet him for dinner, that's a good thing.
Yeah.
If you get out the submersion of cold and you just want to go to sleep after that, you did too much.
Okay.
Yeah.
Why is that? Why is that an indicator?
Because the mitochondria repair has gone too much, and the body needs extra love to get it back.
To get it back, so you're like, I'm ready.
Yeah.
I'm ready to go to sleep,
just-
and like I need all that recovery time from this recovery tool.
And remember, if you're looking for human growth hormone response, which is youth and everything else, you don't want to go to recovery. You want to pay the price of the pain of lifting heavy. So if you're lifting so heavy, that delayed onset of muscle pain,
Fatigue,
that's actually produces the human growth hormone. So you don't want to go to recovery if your goal is increase your human growth hormone.
Okay.
So that's kind of a sub.
Yeah. Throw that in there.
Another side of it. Yeah, absolutely. Let's talk. I mean, you mentioned mental exercises for dealing with pain. We talked about the importance of the breath, which to me, that's always when I come back to, I'm like, oh, the breath. It's always accessible to us. So if we learn how to breathe, right, and how to breathe to calm ourselves, to encourage, us to acknowledge what's happening in our body, to be aware. What about some other mental practices that you would recommend?
There is a simple thing called awareness technique. And you can do it any time. I'll do it in the morning because my eyes are not open and I can do it in bed. every 5 senses that you have, relate that to and activate them, wake them up. What is your eyelid feeling when they're touching each other? What is your body feeling when it's touching the mattress? What is the noise that you're hearing from the fan? What is the sound that is coming from outside? What is the taste in your mouth? What is the smell of air? So once you get, and you don't have to do anything, you just have to acknowledge this sense is working, this sense is working. The whole school of meditation is to reduce the noise.
I love that.
To reduce the noise. Don't make it complicated. Yeah. You don't have to cross-legged figure 8 and sit down for 45 minutes. I don't believe that. Because the essence of all of us is intelligent. It was a one big bang. So we all came from oneness. And the intelligence that runs in you, it runs in me. And it runs in our prophets and heroes. The same intelligence is there. All we got to do is shut the interference, so the wisdom can sit down, stand up and talk. And the best way to do it is stop thinking. Since it's hard to stop thinking, because we don't do that, stop thinking less. The lesser you think and the less you can the more you can quiet yourself down and just have a present time consciousness. Again, present time consciousness, you don't have to go to Himalaya to get it.
Right.
It's how I look at you to give you my 100% of your attention. That's my present time consciousness.
Yeah. So that kind of fits within like a lifestyle habit as far as knowing how to shut out the noise. Is there anything else that you would add to that?
Breathing, shushing breathing. That's what we do with all our patients. Inhale, exhale longer.
Give an example of the shh. Is it just a...
Just like shh. And listen, you have a dog?
I do. Not by choice, though.
When he or she acts up, what do you say to him?
I don't know if
No,
we can say it on the podcast.
no. But you say,
Oh, yeah.
you have children.
I have children and a dog.
When they wake up and they are cranky, what noise do you make?
Usually I would shush, like,
And you go to Bangladesh, guess what they do? They're not going to say,
yeah,
they're going to
it's the
say,
same thing. Yeah.
It's a universal noise. So that's why when you close your eyes, take a deep breath in and you exhale with the sound of a shh. As a matter of fact, Huberman said if you can exhale for 45 seconds, by the way, we did this 20 years ago, so it's not stolen from him. We actually I created that breathing technique. The exhale with the sound of a shush is very soothing.
For 45 seconds?
You can.
Oh, my goodness.
It's going to
At 10 seconds is great.
Okay.
At 15 is beautiful. At 45, you're like elite breather.
Yeah, you're in the matrix at that point.
No kidding. Okay, here we go. So we talk all the time about healthy routines, right? We want to be taking care of our bodies. Obviously, in the work you're doing, chiropractic care can fit in with the prevention and treatment of low back pain. So talk a little bit about that and what is, you mentioned like you want to have a regular time of seeing people, but what does that look like beyond that?
What we like to do is we like to evaluate you at first.
Yep.
Diagnose you the second, and find the remedy third.
Yep.
Usually, 99% of the time, it requires movement of the spine or relative joint.
Yep.
Why? Because we need motion.
Yep.
So if we don't move it, it gets stuck.
Right.
Number 2 is make sure that we can function, flexion, extension, rotation.
Yep.
And we want to make sure there is an element of neurology involved, because not only you have to address the muscle, you have to address the joint and the nerve.
Yeah.
How do you do the nerve? Is by controlling the motion.
Yep.
So if you're doing a bench press, rather than just sending it out and done, you want to control this that you can stop it at any given time.
Right.
Okay.
So we want strength and power. If you just do strength, and I don't know, most people have confusion about power and strength. Power is like strength times velocity. So you can say, and both of them are needed. So not only the strength is needed, power is needed, because power is when we move through space with load fast, pick up the kid, jump, drop. So you want to make sure that that body gets trained in all aspects. So strength, power, adjustment
Yep.
and soft tissue technique, the IMJT that we do. Soft tissue technique, our body has certain wisdom to maintain motion. If
Yep.
I push more than this, it's going to rip, bring it back.
Yep.
We have a way to bypass that safely so we can introduce the motion. Once we introduce the motion, right away we put it in test.
Yep.
So we bring the neurology, because my famous saying always is muscles are like good underwear. You pull it, it stretches. You let go, it goes back to your own. So if you're just stretching the tissue
Yep.
and you're not loading it,
Yeah.
you're not necessarily getting all the benefit of it.
Yep.
But that's what I think is necessary. So not only do I do the adjustment, do the soft tissue, and do the rehabilitation.
Yep.
All has to happen at the same time.
How can someone, they come and see you 12 times over the course of, maybe it's once a week for a while. What can people be doing in between that to be supporting what the work they're doing with you? Because that's a small period of
That's
time in the grand scheme of it all.
Remember we said
Yep.
constant, variable?
Yep.
We introduce lifting technique right on the first day with our patient.
Got it.
And we give them exercises. We give them homework. No more than 1 to 2 exercises at a time. Because if you do 3, the rate of compliance drops significantly.
Yep.
1 or 2. If one is good, 2 is the best.
Yeah.
3 is too much.
Okay.
And we will see and check them every time they come in. We take them actually on the floor.
And go do that.
Because if you tell me, when I squat, well, okay, then let's go see you and squat.
Yeah.
That's
Yeah.
where we want to see if they're understanding what we teach and what they're materializing.
Yep.
So it's on-site supervision, 2 exercises at a time. They'll carry that.
They take that with
Yes,
them, and that's what they're
right.
going to integrate.
That's
okay.
right. And we have really good guidelines. When you ask them to, flex forward and they're 17 inches off the ground, they can't touch it. Yeah. And in about 3-4 visits, they can actually go 2 inches from it. They can understand this is working for
Yeah.
them.
They can see the difference.
Exactly.
Yeah.
Not only they see it, they should also feel the difference.
Yep.
Yeah. I mean, we covered a good amount, right? And we want to make sure before we get our mic drop moment with you, is there anything else you want to leave our listeners with around what they should know about when it comes to back pain?
Just don't be shy. Go and find a person that can help you and do it. It's not worth it. This journey is not a great journey if you want to take it on your own hand.
Yeah.
Because just like picking up a new sports, if you have good habits right at the get-go,
Right.
Yeah.
it will prolong your much better return. If you just want to wing it on your own and you watch some YouTube or ask your buddy to tell you something, I don't think. Just find a professional, do a free consultation, get a green light from them, and then go tear it up.
Yep.
And if it's not, we actually tell you, these are your issues. You can do it on your own, or you can team up with us.
Yeah.
We just want to make sure they have the awareness.
Yeah. Well, and to know for those people who are suffering from low back pain that this isn't something you have to continue suffering with. In many
No.
cases, like this is something that we can help with, or you can do things about too. You can feel empowered to do things about.
95% of these issues are reversible.
Right.
95%.
And that's good to
So
know.
it's a shame if you have it, then you just suffer with it.
Right.
Yeah.
Remember the guy with the shoulder replacement, one visit?
visit.
Oh, it was just unbelievable.
Yeah, that's awesome.
I love listening to these things. It's like,
Yeah, but changing lives. I'm going to throw the mic drop moment at you. You ready? We had the 80s. We had the 90s, 2000. Now we're in our 2020s. You said it a few times, constants and variables.
Yeah.
Has anything that was a constant turned into a variable, or a variable that turned into a constant within your years of practice?
Ooh, that's a good one.
has anything that's been a constant and it becomes a variable? That's a good question. What was constant was the life is a struggle.
Okay.
Physically, mentally, financially, spiritually. And I thought that was just variable. As I'm getting older, that's the constant. And if you embrace the grind, and if you embrace the obstacles, and you get determination to go through things, you have a much better journey in life than avoiding grind and avoiding toughness.
Yeah.
On the other side of comfort is growth.
Absolutely.
It is.
Right? Growth
It's all
and
about
change.
struggle.
Yeah.
If you look at your yard, the grass and weeds are struggling together. 86% of life force consume each other to live one more day. There is nothing beautiful. Guaranteed space. Look at the black holes. They're consuming galaxies violently. What do I expect that my life should be smooth sailing?
Right.
So I say pain is part of it. As a matter of fact, I will tell you, there are a certain group of people that they don't have any pain fibers. They die very quickly because they have no apprehension of doing things. They jump off the third story. They don't feel it, but they'll break every bones.
Yeah.
So pain is not a bad thing. Embrace it
Yeah.
and work through it, and you're going to be.
Yeah.
But struggle is part of it.
Yeah.
Yep. Oh, well, that's
Good.
a good note to leave us on. All right, Dr. Reza, we're so glad you could finally join us. We've been trying to get you on here for a while, so we're excited you were able to be here. If people want to learn more, they can visit lifeclinics.us to learn more about Life Clinic and the services that are offered there. Anywhere else we should point them to?
It's anybody who's got wisdom that they can help and they can trust them.
Yep.
I would love for all the members to go be seen by somebody.
Absolutely, because we have Life Clinics in many of our Lifetime locations. Also, we do have some content from Life Clinic at Experience Life that we want to make sure to point people to for education and information. So,
Thank you so much.
yeah, thank you. Thanks for coming on.
Thank you.